Periodontal disease is an infection of the teeth, gums, and the bone that surrounds the teeth. The main cause of periodontal disease is the accumulation of plaque. Plaque is the sticky film of food and bacteria that forms constantly on your teeth. It's hard to see plaque, but look at how it shows up after we've stained it with red dye. The blue spots here are tartar. Tartar, which is also called calculus, is plaque that has built up and mineralized. Periodontal disease develops when plaque and bacteria invade the crevices between the teeth and gums. Bacteria, like the ones shown here, produce toxins, and it's these toxins, combined with your body's reaction to them, that destroys bone around your teeth. Once bone has been lost, it never grows back. When too much bone is lost, there's so little support for the teeth, they get loose and have to be removed. If you have periodontal disease, you may have some of these warning signs: persistent bad breath, bleeding of the gums when brushing or flossing, soft, swollen, or tender gums, gums shrinking away from the teeth, loose teeth, and changes in the spaces between your teeth that reflect changes in the underlying bone. You may also have none of these warning signs. In fact, most people who have periodontal disease aren't even aware of it. Since you may have no symptoms with periodontal disease, we perform a thorough examination with a periodontal probe and X-rays. With periodontal disease, the bone level falls and the gums pull away from the tooth, forming a pocket. We measure the pocket from the bottom of the pocket, where it's attached to the tooth, to the top of the gums. A probe reading of more than 3 millimeters is a sign of periodontal disease. Bleeding is also a sign of infection. These are healthy gums. They're tight against the teeth, there aren't any pockets, and they don't bleed. Now notice the difference with early periodontal disease. In general, the deeper the pockets, the greater the spread of periodontal disease. In this case of moderate periodontal disease, we see the red and swollen infection of the gums. Look especially close at the difference of the gums between the teeth. This is where periodontal disease usually starts. X-rays tell us a lot about periodontal disease. This is a healthy mouth. The bone comes up high around the necks of the teeth, and it's even throughout the mouth. This is advanced periodontal disease. The bone level is much lower. Notice how uneven the bone levels are, compared with the healthy mouth. And notice the tartar on the teeth. Tartar shows up on this X-ray as small white lumps on the sides of the teeth. Once we've found periodontal disease, we'll talk with you about treatment options and proper home care to minimize bone loss and restore the health of your gums.